My name is Janice Weiner, and I'm running for State Senate SD 37. I'm pleased to be talking today with Leslie Carpenter, who is a tireless local advocate for the seriously mentally ill. She's also on the Johnson County Board of NAMI. She is the president-elect, and she teaches the family-to-family class. And recently, she's been doing quite a lot of lobbying for a bill that's going through the Iowa legislature together with her husband, Scott. Leslie, thank you very much for coming to talk today.
You're welcome.
We hear an awful lot about how Iowa is way at the back of the pack when it comes to mental health care. Why is that, and what is going on?
Oh, that's a great question. Some things have happened over the course of years. One is the IMD exclusion, which is basically a rule that came down from the federal government to make it so that Medicaid cannot be used to reimburse for inpatient or long-term facility care of somebody that has a serious mental illness for any facility that houses more than, I think, 10 to 15 of those people. When that happened, soon thereafter, many of the states around the country began closing long-term state hospitals that would take care of people that had the most serious illnesses.
I know that you and your husband have a son who's seriously mentally ill, and that's one of the reasons you've become such a tireless advocate. What needs to happen for the seriously mentally ill to actually be in a safe place and to have a chance to get better?
That's very good. Many people that have serious mental illnesses also have another condition in which they lack insight that they are ill and need to stay on their medications. It's called anosognosia, and that's a tongueful, but it basically just means that their brain isn't working correctly. And a part of that means that even though they are sick and they know they're taking medications, they still live in a situation where they don't believe those medications are good for them, and they actually tend to think that the medications are poisonous. And so they go off their medications. When they go off their medications, they go back into psychosis and they have to be re-hospitalized. That's been a large piece of what's happened with our son, and he's been hospitalized 20 times now. So the piece of legislation that we're most excited about is called assisted outpatient treatment. And it is basically improving upon a bill in a law that we already have in the state of Iowa. Currently, the law only allows the judge to place somebody on this court order to remain compliant with their treatment if the person is presently a danger to themselves or others. And that is not something they're likely to sign as the person's being discharged from the hospital, because then they really should have been staying in the hospital. The change is that it will allow them to place this order if the person has a strong history of repeated hospitalizations from having been a danger to themselves or others in the past, but they're no longer at that point and now they're ready to go back into the community. This will allow a stronger team of people to be able to help them stay on their medications and stay healthy.
What can an individual senator or representative do to help move this whole debate forward and make improvements reality?
Very good question. One is support every piece of legislation that comes across their calendar to vote upon that is going to be helping improve the way the MCOs are reimbursing providers at all levels. Secondly is listen to your constituents, take it in, and then perhaps put your staff to work on investigating what are the barriers to treatment. Third is speak about mental illness like we would talk about any other kind of illness. It's a problem of the brain, as is Parkinson's disease, as is Alzheimer's disease. We don't need to talk about these like there's something we have to whisper about. These are illnesses, just like any other illness, that happen to affect the brain, and they're actually extremely tragic. And we need to actually be talking about them and treating them.
And improving the lives of all Iowans who are affected by them.
Thank you. Yes.
Thank you very much.
You're welcome.